it's a topic very important.
Good morning, everyone. Thank you for the invitation to speak at the Congress today. This is a topic which has been of interest to us for some considerable time now, and I'm going to share what is very much an introductory study, a snapshot, which we very much hope will encourage further work. I'm presenting this on behalf of both of us. Dr. Wing isn't able to be here, but she's asked me to pass her best wishes on to Congress and to many old friends who are here today. So I'm going to be talking very briefly about what are the concerns with regard to excessive drinking of fluids in autism, how common is it, the methods that we use to gather this understanding, what were the results with some preliminary conclusions. So what are the concerns? Well, we know that excessive drinking of fluids is associated with a whole range of health and behavioural problems, and that the urge to drink can be a sign of underlying physical disease, such as particularly with diabetes. We also know, and especially in residential services these days, that a high intake of water tends to be regarded as a healthy activity, and we see young people in particular taking on board huge quantities of water, but we know that it can also be very hazardous. Those of us who remember Andy Warhol and his family tried to bring a legal suit against the hospital for giving him excessive fluid intake in his last days, which they allege contributed to his death. Jacqueline Henson, who drank 4 litres in under 2 hours as part of a drinking competition. Again, the Lighter Life diet, a special fad diet that she was on, died. Anthony Andrews, who was an actor in the West End of London, in playing one of the key roles in My Fair Lady, was consuming 8 litres of liquids a day of water and finished up in intensive care. So there's quite a good literature, not from the autism world, but from the general literature about the dangers of excessive drinking of fluids, which can be life-threatening. So we know that thirst is a mechanism to correct imbalance of the control of fluids, and involves the secretion of ADH, also known as vasopressin, secreted by the hypothalamus. Thus, the drive to drink is related to blood osmolality. We know that most of us, when we take in water, it's routinely compensated by renal excretion. However, if this is extreme, then the mechanism fails, and we know of many cases where this has led to dangerously low sodium levels, renal failure, brain inflammation, and heart failure. And I've mentioned some of those cases. Having a few problems with this, but don't worry. Okay, good, thanks. We also know from the general psychiatric literature that excessive drinking of fluids is widely reported in schizophrenia, particularly chronic schizophrenia and catatonic schizophrenia. And there's evidence that many cases of ASD are undiagnosed or misdiagnosed and confused with other psychiatric disorders. Dr. Wing has described the presence of excessive drinking in autism as a feature of autism, but there have been very few studies that have been done. We could find only 8 studies, which were fairly small studies, in the literature related to autism, as opposed to 138 with regard to schizophrenia. So this study suggests that excessive drinking of fluids is present in a significant minority of individuals with ASD. We think around about 1/3 of people who present with some kind of this problem. So we sent out a questionnaire from the National Autistic Society via the National Autistic Society website, which was to be completed anonymously. The response, we were surprised by the large response. We got 637 responses, mainly from parents, and we advertised for people who they regarded as displaying excessive fluid intake. We also looked at 200 cases that we'd seen at the Centre for Social and Communication Disorders, but they hadn't been referred because of the concerns about excessive drinking of fluids. And we received consent to use this data for research. So, from the questionnaire, we asked the following questions. Only wants to drink with meals, occasionally wants to drink with meals, often wants one drink between meals, several drinks, and so on. And we only, those who were rated as 4, 5, and 6 were included as having excessive drinking. So we really only were interested in 4, 5, and 6. Sorry about this. So as you can see from the results, they were mainly, but not exclusively, concerned with the 0 to 10 age group. That isn't to say that with the older group that this problem does not exist. And we had a number of people who were in middle age who this happened for the first time when they were in their 30s and 40s. As you would expect, most of them were male, but again, not to exclude the females. And this really confirms the numbers of the people involved in the study, which shows again that most of these problems arose in very early childhood, between 0 and 5 years. When we looked at the comparison of the NAS and the non-NAS, if I could call it that, the Centre for Social and Communication groups, you will see that, again, that there are a significant number in the group which were not referred for excessive drinking of fluids as a problem. When we looked at the type of autistic disorder as a percentage of those with excessive drinking in marked form, comparing the two groups, again, you will see that there aren't significant differences. When we looked at the prevalence of by diagnosis, when we combine the two groups, again, you can see that those with the diagnosis of Asperger's syndrome were slightly ahead of those with autistic disorder. When we looked at the presence of excessive drinking in marked form and associated conditions as a percentage, again, you will see when we looked at other conditions, very little difference between the two groups. And we were looking at things like Fragile X and other psychiatric disorders, particularly anxiety. We were also interested in the comments that a number of parents had made before the study that diarrhea and vomiting were also associated with excessive drinking of fluids. So you can see that these are not significant results, but vomiting, diarrhea can exacerbate an already difficult problem for families. When we looked at the differences between those with severe intellectual difficulties and mild intellectual disabilities and those without, again, you can see the results of the two groups. The without intellectual disability were far more prevalent in the Centre for Social and Communication Disorder group. When we looked at comparing the frequency of drinking, both as a number and as a percentage, you can see that we were interested in how frequently people were taking fluid on board. The majority, as you can see, as soon as they'd finished one drink, they were demanding another, and that again was very difficult for families. And the smaller group, but again a significant number, just under 20%, more or less constant drinking of fluids. When we look at the rates of drinking, you'll see that the majority, 40%, gulping very fast. I'm sure that some of these behaviours will be very familiar to you. What were they drinking? Again, a great deal of concern. The majority seemed to be drinking water, or in some cases, and particularly in people who had lived in long-stay hospitals, caffeine, endless cups of tea, endless cups of coffee, which again led to, in the view of the parents, led to other kinds of behavioural problems. Those who were drinking from the cups and glasses belonging to other people, those around 12–15% would drink literally from anything, and a small number, but again a significant number, were drinking potentially harmful substances, and parents were saying they had to keep everything under lock and key and really be very protective of their children. So what happened when they were denied a drink or having to wait for a drink? Well, a small minority waited patiently, but it's clear from this graph that clearly having to wait for a drink causes some distress. We were also interested in the effect of the environment and the activities. Were they more likely to drink when they were bored or less active? And it would seem that it makes very little difference on the overall pattern of drinking. When we looked at the effect of the environment and activities by the percentage, again, you will see stress. It may be a factor, but it doesn't seem to make any difference in the rates or frequency of drinking when people are stressed. So what are we to make of this? Well, I would emphasize that these are preliminary data. It's really only a snapshot. And we think that a population-based study would be helpful because of the large numbers that we found in this preliminary study. The strength of response and the interest that we've had subsequently would suggest that it's not an uncommon problem. We do know that there are a substantial minority, and we believe around a third, as I've said, across the spectrum, with or without an intellectual disability. The clinical manifestations of excessive drinking of fluids do not appear to be the same as in other repetitive behaviours, nor is it related, as I've said, to stress or activities where the people are bored. In some individuals, it appears to be physiologically driven, and we don't know. The previous speaker was talking about the sensory aspects of feeding disorders. We didn't know the sensory profile of those affected, and that would be a very interesting piece of work to do. We know that it tends to start early and is less likely to start with increasing age, but we should not ignore those who do develop this problem in later years. We asked people, why do you do it? Almost 50% of those people who could respond couldn't really give a reason. But of those who could, 80% reported either thirst or a dry mouth or a nasty taste, particularly a metallic taste in the mouth. We understand that there is an association with comorbid psychiatric disorders, but we're not really clear how that works. And we would argue that the results of our preliminary study would suggest that further investigation may suggest a link with the underlying neurology of autism itself. What we do know, however, is the distressing and the potentially hazardous nature of this problem. And talked about, there have been a number of deaths as a result of excessive drinking of fluids, calls for greater efforts to understand and to intervene. Thank you very much for your attention.